Welcome to the Pediatric Department at ESHT. I am Salah Mansi, Pediatric Consultant at the Conquest Hospital. We have inpatient unit with 21 beds. We have day assessment unit, and next to it is day case surgery. We also have special care baby unit with 4 hot beds and 6 beds for continuity of care.
I'm Geeta Gopalakrishnan. I'm one of the acute consultant pediatricians and also the acute clinical specialty lead for pediatrics. We have 2 hospitals within the trust, Conquest being the acute admitting unit, and Eastbourne is the short stay unit where children are treated and either admitted or transferred over to an admitting unit. The consultants take part in a consultant of the week rota, rotating on both sides.
Welcome to the Scott unit, which is the Community Pediatric Department, Eastbourne side of the East Sussex Healthcare NHS Trust. This department mainly cared for children with developmental disorders, autism spectrum disorder, and children with complex physical disabilities such as cerebral palsy. So we see all these children in this unit here and we carry out a detailed assessment, investigation and management, where we work closely with physio, speech and language and occupational therapists. We also have 1 foundation trainee rotating through this department every 4 months, and that they gain some experience in developmental assessment, autism and assessment of children with complex physical disability.
My name is Miriam. I'm a LAS SD1 doctor. So usually you start your day at 8:30 at handover. So there are 4 areas where you can be. So one is Kipling ward, which is just the general pediatric ward. There is an acute assessment unit. Then there is Frank Shaw ward, which is the maternity ward, and Skaboo, which is our special care unit. It's a level 1 neonatal unit. So that's already been decided before, so you know where you're going to be, and at handover just go through all of these different areas. You know what's going to happen that day, you know which registrar is going to be there as well. So after the handover, we usually go to our places. So on the ward, it consists mainly of a ward round, and in the afternoon, all sorts of jobs really, chasing up people, writing discharge summaries, arranging investigations and also looking at the results of those investigations.
It's quite a well-supported unit because we have registrars and consultants who we get instruction from in terms of the overall management of a patient. As an F2 doctor, I'm new to pediatrics, so my knowledge of children isn't that great. So it's good to know that we have support from everyone. Other than that, we get you get taught by the nurses, so the Skaboo nurses, pediatric nurses, and the midwives, just about general well-being for children and what is expected of you from day to day. So that's sort of a typical day on pediatrics.
Hi, my name is Rhiannon. I'm one of the nurses in charge on Kipling ward. We are here to help you with anything you need any help with. No question is a stupid question. We like to work as part of a team, so you help us out and we can help you out.
I'm Liz, I'm one of the children's community nurses, which you can find through the double doors off of Kipling SPOW unit. I'm one of 4 of the team. I specialise in the children's oncology. We also see children with cystic fibrosis, special needs, complex needs, constipation, eczema. So if you have any queries with regards to any of those children, please do come and find us if you need us.
Hi, I'm Rachel Brooke, and I'm one of the neonatal sisters and the practice educator for Special Care Baby Unit. When the new doctors come, I get involved with the induction with one of the consultants of special care, make them feel welcome, come and show them around, get them familiarised with the equipment that we have. I like to make sure that I'm always available for them if they need to for support and reassurance. I will go with them to have conversations with parents as well if they feel a little bit uncomfortable, and just make them feel part of the team.
So you can also be in clinics, either in the Conquest Hospital or in Eastbourne. All the clinics are consultant-led, so you sit in with clinics and you just observe. You have the opportunity to see different sorts of clinics. So we have some clinics where specialists from Brighton or Evelina come over once every few months. You have some specific clinic like allergy or constipation clinics, which are especially interesting for example, GP trainees who will see more of those kind of things.
Hello, my name's Joe. I'm a healthcare assistant and final year student paediatric nurse. This is the Kipling Outpatients Department, which is the paediatric outpatient department for Conquest. We have 4 consulting rooms and we run general outpatients clinics as well as some more specialised clinics such as diabetes, echocardiography and dietitian clinics.
You can be on call on the neonatology side of things, where you will help out on SCBU. You'll also attend deliveries which may be high risk. If they're quite high risk, you'll have a registrar who goes with you. And then you can also be on call on the Kipling or ACU side of things, where you'll hold a crash bleep and you'll also be getting referrals from the emergency department.
So you can have a standard day where you start at 8:30 and you have another handover at 4, where you hand over to the team who's also on the long day, just to make sure that everything has been handed over. So then you have another handover at 8:30 at night, where you hand over to the night team. So the night shifts are always from 8:30 till 8:30 the following morning, and the days can either be a standard day or a long day. The weekend days in Hastings are also always long days until 8:30 p.m. The weekend is slightly different. You start at 10 and you finish at 6 p.m. So those are shorter days. So if you're on nights, you're only ever on nights at the Conquest Hospital, never in Eastbourne.
If you are on the Eastbourne side, on the Friston unit, you will be on call, and again, it's similar to the ACU at Conquest. You'll be receiving bleeps from A&E. And if any children are unwell and they need to be admitted overnight, they'll be transferred over to Conquest. Yes, I think the more I've gone on, the more I realize that the learning opportunities are, really great on paediatrics. And that's because you learn on a day-to-day basis. So whether it's at handover, whether it's just doing your day-to-day jobs on the ward, you learn.
I think teaching is a continuous process. It happens at handovers and ward rounds, which are informal teaching opportunities. I think more formal structured teaching happens every day. We have a combined radiology meeting on Monday afternoons for about an hour. On Tuesdays, there's a grand round at Conquest Hospital, and in Eastbourne, it's on Mondays. Wednesdays are dedicated paediatric teaching, which covers a range of topics with opportunities for the trainees to present, and dedicated teaching by one of the senior members of the team. And we try and cover all specialities across the paediatric curriculum as much as possible. Thursdays is more of an informal discussion about cases on the ward which have some difficult clinical dilemmas, and which the trainees have an opportunity to present and learn from them. And Fridays is usually the mortality morbidity meetings. We have in addition audit meetings every 3 monthly and paediatric mortality morbidity meetings every 3 monthly.
And then presenting, if you like, presenting, it's a skill that I think all doctors need to have. You get that opportunity to present, not just formally during teaching, but also on a morning during handover. Usually the SHOs go ahead and present patients as a way of learning, and then you get feedback from your registrars and consultants.
Because the pediatric department is on 2 sides, the Eastbourne and Conquest side, we as a department has installed a video conference equipment on both sides, making it easier for trainees to participate in all the training and teaching program within the department, and also encouraging our clinical and educational supervisors to actively participate in the training programs in the department.
Working in the pediatric department is a very good learning opportunity, because you get more information, more skills as you are on the shop floor. There are opportunities for you to contribute to the teaching program by presenting cases and writing case reports with your consultants, or in doing audits. Attending the courses is very well supported by the department. So you need to apply for courses like pediatric life support or neonatal life support, and the time and the resources are available.
There are educational clinical supervisors. They will be the first point of contact. Clinical supervisors are always present on the ward, and I suppose it's the consultant who's doing the on-call or ward round that day. For educational issues, you have the education supervisors and they have dedicated meetings with them. In my role as a clinical lead, if they are not getting what they want from their immediate supervisors, then they can come to me at any time for advice and help.
If ever you have a question, especially when you start, you have questions about not just about managing unwell patients, but how we go about organizing scans. Follow-up is quite important, how we go about doing that. We have an induction and the consultants tell us exactly what is expected of us. If we have any questions, there's always a registrar who's on call, so if it's overnight, and there's always a consultant who's on, who could come in to assist if somebody is very unwell. I think from looking at an MDT approach, we have the nurses on, we have nurses and midwives. We also have physiotherapists, especially now in the outpatient setting, pharmacists who can help with drug prescription, and then we also have consultants who act as our clinical supervisor.
During your stay with us, there will be continuous feedback. It might not sound to you or feel to you like a feedback, but any talk with any of your seniors will be a feedback of what you are doing. If you feel at any time that you need to get a feedback, then approach your clinical supervisor, educational supervisor, or the consultant of the week you are working on, and ask your questions and have a chat.
There is an official sort of rota coordinator, but there's also one of the SHOs who deals with the rota as well. We have a WhatsApp group as well. WhatsApp is quite a useful way to swap any on-call shifts. So usually you have to apply for it 6 weeks in advance.
Pediatrics is a very daunting specialty. I think often trainees are very scared when they first come in. But I must say, I think we have registrar presence all the time. But also if they don't feel happy, they can call for help at any time.
I encourage all the trainees to do an online training program on recognition of the sick children. And I always email this site to the trainees about 2 to 3 weeks prior to starting. And the survey we had from the trainees in the department at the moment confirmed that they find that the online training very helpful, as it gives them very good grounding in pediatric management of acute cases on the ward. And that's very, very helpful.
I have definitely enjoyed it. I think this is a very well protected specialty. I mean, there's always a registrar available who you can ask, who you discuss things with, and it's a very supportive environment.
The fact that I'm so well supported and I don't feel pressured into doing things that I'm uncomfortable in, that makes the job really enticing. And the other thing is you adopt a holistic approach. So you don't just look after the patients medically, but you look after them in terms of long-term follow-up. There's always social issues, and when you treat patients, you can see how happy the patient is, and then their parent. You see how you affect their family as well. How happy people are after you as a team have intervened with that patient.
I think pediatrics, our pediatric team, are always a very friendly department, and I hope you enjoy every minute of it and take back good memories with you.
I'm sure you will enjoy your experience with us, and to make it very useful, please, during your stay with us, come and talk to us about anything, and don't leave the department but with good memories in your mind.